Hi everyone, welcome to MedCircle. It's our first live video. I'm joined by Callie the Lab and our founder and CEO, Doug Colbeth. If you're watching this on replay or if you just happen to join us right when we started, you can access our free series on the different types of providers just by using the links below this video, or if you go to medcircle.com and just go to types of providers. It's a fantastic series by double board certified psychiatrist Dr. Dominic Sportelli. It will give you so much information on how to navigate the often complicated mental health system, how to find the right mental health professional for you or a loved one, what questions to ask, and red flags to look out for. It's incredibly insightful. It's yours free because today is World Mental Health Day, and a big part about today is really understanding the different facets of mental health. And when we talk to Doug Colbeth about mental health, we often talk about mental health in the workplace. Your companies that you had decades ago, you were already smashing down the stigma of mental health. You were speaking very transparently with your employees and coworkers and other leaders in management, but that wasn't common practice.
Oh no.
And it's still not that common, but
No.
it's becoming more and more necessary. Why is it so critical that we can talk openly about mental health at work?
Well, let me first point out, I don't think the other two businesses would have been as successful, and they both became highly valuable public companies, if I hadn't talked openly about mental health. And yeah, back then, you go back 20 years, not too many CEOs were doing it. And I challenge CEOs today to do more of it because I think it's the greatest opportunity a company has.
And why is that?
Well, I'll never forget the first time I did it. It was in a little town called Champaign, Illinois. And I told a little bit of just some personal experience I had in one of the real low points in my life when I was a young man. And the immediate connection that was made with these employees was incredible. And I knew mental health was pervasive at that time. But once I opened up just a little bit about my own challenges in life at that point, and before that, people were really lined outside my office, wanting to talk more about it. So it's an amazing opportunity for a company to tell an employee that they care more about them.
Yes.
It's not just a worker.
Yeah.
No, we care about you as a person. And what we've seen in both those ventures who became large companies, you develop a sense of loyalty, and it motivates people more, builds trust, better productivity, less absenteeism, and the most recent one up in Canada, they've implemented all sorts of autism at work programs. They have informal groups that go out and look for the best local providers for treatment services.
Yeah.
And all those efforts were the genesis of MedCircle, to build an online video streaming platform for in-depth mental health education, because you should be doing that before you seek treatment, during treatment, and after treatment. Education would have saved me probably 7 years of my life where I was misdiagnosed.
Oh, absolutely.
I was diagnosed as I had clinical depression in my late 20s, and took 7 years to get the correct diagnosis of bipolar disorder. So.
Yeah. And more than, or just about 50% of people actually get a misdiagnosis the first time. And I mean, if we had that with a heart disease or something, or a physical, more traditional physical ailment, I mean, it would be front page news, not just on October 10th, World Mental Health Day. It'd be front page every day.
Yes.
Yeah.
Well, in the case of bipolar disorder, it's over 65%.
Even more. Right.
And I've got to tell you, you give the wrong medicines to someone who's challenged with bipolar disorder, you can really send them into a manic episode.
Yes. Now, we're broadcasting on a few different platforms right now, but I would like to poll our audience. How do you feel, or how comfortable do you feel sharing your personal mental health struggles or wins in the workplace? Is it something that you would feel comfortable going to your boss and saying, look, I'm dealing with X, Y, and Z. I need to take Friday off. That will be better for me. I will come back stronger on Monday if I can have this time. Do you feel comfortable with that, or is that something you would never say? I feel like even today, I'm lucky I work at MedCircle. Of course, I can talk freely about mental health anytime I want. But most people are working at a company where they wouldn't dream of going to their boss and saying that.
Right.
You're a boss, and you've been a boss for decades. How would you recommend employees go to their management or go to their supervisor and have this conversation?
Yeah, so that's a great question, and it's not a simple one to answer. That's why I urge CEOs to take the lead. If the CEO takes the lead, believe it or not, the leadership team kind of says, oh, okay. Everyone becomes more open-minded to it. Employees become less fearful of it. And I tell people, no, you've got to think twice about this before you speak to management and HR, for example. But I will say this, it is light years better now than it was 20 years ago. I'm seeing a much greater interest in it, but you have to obviously gauge that. And we had a philosophy at Kinaxis that you'll never suffer consequences at work because you may have a disorder, but you really need to go get treatment. And we didn't tell them what kind of treatment. We didn't even tell them what type of disorder. We didn't diagnose anybody. We didn't have patient data. But we did have lists of potential resources people could access. And it wasn't just a directory. It was because other people were getting treated. And we would share that.
Yes, it's still a unique situation to be in. I can get some of our comments from YouTube, and Roo says, my manager won't even give me time off for physical illness, let alone mental. Jenny H says, fortunately, I work for a small family business that's willing to work with me with my issues that I may have. And Carmen Mendez says, I would never do it. I'm a teacher, and that would label me in a bad way. And if you're just joining us, they're talking about how comfortable they feel going to their management or their workplace and talking about their mental health. Your first step, like Mr. Colbeth at MedCircle, founder and CEO, has mentioned, is education. And the quickest, fastest way you can start that education is by visiting medcircle.com or using the links below this video. And if you want to grab an all-access pass, grab an all-access pass. But if you just want a taste of what we can offer, then check out our series on the different types of providers with Dr. Dominic Sportelli. One of our moderators doing social media will drop that link in so you guys can easily access it. It will cost you $0, and it will give you so much information so that you can start your mental health journey off on the right foot. If you have a question for myself, for Callie the Lab, or for Doug Colbeth, just go ahead and type it in the comments and we'll try to get to it. We have a question from @OnAWhim. I have an eating disorder and I'm scared how to go about talking about this in a new job. Now, neither Mr. Colbeth or I are a psychologist or a psychiatrist or offer any mental health treatment at all, but from a boss perspective, how would you want an employee to handle this?
Well, I think the best advice I can give somebody is they certainly have to think it through. I'm not suggesting that anybody early on in a job, early on in a company to necessarily trust that somebody's going to be open-minded, compassionate, and see the big picture. And the big picture is you help an employee, you really have somebody committed and really energized to work for you. But not everyone is open-minded at this point. I think it's a lot better than it was 10 or 20 years ago. What I would suggest, if there's an HR organization in the where you work, I think nowadays they're probably going to be open-minded, and it can be as simple as, are you aware of any resources? How does the company have any mental health services or educational services available? Sometimes if you look at your employee benefits, you'll see many of them now are offering online therapy or educational assistance, employee assistance plans. You hear the term EAPs. If a company has those type of benefits, I'd feel a little more comfortable bringing it up. But I really want to get to know my boss. I want to get to know the HR before I divulged anything really personal. And I understand the stigma.
Yeah.
But hopefully we'll have the companies or organizations proactively bringing up the fact that not only are they compassionate, but they really want to help the employee.
Yeah, absolutely. And if you're working for a company or have a job where you think the entire staff could benefit from a MedCircle membership, let's talk about that. You can email me directly, kyle@medcircle.com. We'd love to see how we'd be able to provide these types of memberships for you and your coworkers. Elizabeth Klebb says, I'm a leader over a team and I always tell them to talk to me about it and I try to keep the conversation open. What are some ways managers can keep the conversation about mental health open with their employees? Doug, any thoughts?
Well, what I felt was important is I shared a little bit about myself.
That's so big. Yeah.
Once you do that, and by the way, some CEOs feel they have to be infallible or they have to look like they don't have any mental health problems. Let me tell you, I've done business with a lot of famous CEOs, and believe me, I wasn't the only one that had challenges.
Right, yeah.
So, it's so common, but even so it's so common, the fact that you shared a little bit about yourself, or it could be about your family. Once you do that, you start to build that trust with somebody, and they start to feel you're not going to be judgmental.
Right.
And when someone trusts that you're not going to be judgmental, that's usually when they start to open up with you.
Yes, and like you mentioned, there may be managers, CEOs watching this, and they'll say, yeah, but how does that improve my bottom line? Well, at any given time, 15% of your staff are not operating at their full potential because they are struggling with a mental health disorder or issue. And so if you've made this comparison all the time, if your machine at your job was operating at 85%, you'd be calling the manufacturer going, excuse me, you better get this up to 100. So why wouldn't we do that with our most important assets, which are the people? And I think no matter which way you address mental health at work, it is always a benefit. There's no downside from addressing mental health in the workplace.
Oh, yeah.
Yeah. You get better productivity, happier employees who are committed to the cause, to your mission. I mean, it's all around a better deal.
There is no better statement to an employee that you care about them than openly talking about mental health.
That's right.
There's just no better way to do it. And it's funny, I've obviously visited all the Fortune 500 companies. I've been in all the C-suites in my last two companies. And when I walk in the lobby, there's always these big signs, we value the employee, and it'll say, what are the corporate values? And one or two is always the employee. Well, the first thing is you don't have any business without an employee.
Right.
So you don't need to list all those other things. Right? That is the value, is the employee, okay?
Exactly.
And that's the way I always looked at it. And I've got to tell you, so I'd meet with the CEOs typically, and I'd say, what type of active mental health educational services or informal groups do you have to help your employees with mental health? And how often do you talk about it? And you should hear the answers I got. They were all excuses.
Yeah, I would never do that.
Well, that's HIPAA. That's not HIPAA compliant.
Right.
I go, oh, it has nothing to do with HIPAA.
Right.
Well, I've never had a mental health problem. I used to hear that.
Yeah, right.
Yeah. And that by itself sounds like a mental health problem.
There you go.
But anyway, people are getting better. CEOs are getting more open-minded, but it is amazing the type of connection you can make with employees. Well, not only you talk openly, but you help them get educated. And of course, that's the mission at MedCircle, is to be able to educate millions of people in a highly scalable way.
Yeah.
Because we built one of the best video streaming platforms you can imagine. And many of the people asking questions today have seen the production quality that we do. And we believe in what we call engaging education.
Yeah.
We're not doing more traditional stand-up or written or courseware.
This is not a lecture series.
No,
hopefully you will be engaged and informed and educated when you watch our series. I know we have many members watching our live stream right now, and I thank you guys for being members. If you are a member, I would love for you to share in the comments some history about your membership, when you became a member, what you've gotten out of MedCircle, how you have used it to improve your own mental health or the mental health of a loved one. That's where I think that's why I love, and obviously I'm biased, but I love MedCircle members, because those are the people who already get everything we're talking about.
Yes.
They're the ones who go, I got it. I know that this current system isn't working, this current system is broken. I can't go to Google and just type in a phrase and learn all about bipolar disorder.
Right.
It's not credentialed. I need to hear it from the expert, him or herself. And you get that at MedCircle, which informs your next decision, and that keeps the misdiagnosis rates lower than they would be. It gets you faster treatment, and treatment that works faster than it otherwise would. And it also saves you money, because maybe the first 5 or 6 sessions, and I don't know, I'm just guessing, in a therapy situation is just education. So if you can go on there day one with the education, you're already ahead of the curve.
Well, I just think back in my own situation. I didn't even know what questions to ask when I saw my first psychiatrist.
Yeah.
And the misdiagnosis was seasonally adjusted depression, and then what do? You take an antidepressant, and then that can spin you into a manic episode.
Not great for bipolar.
So,
right.
But it's true, Kyle. If people are highly educated, and we've done this with other diseases, cancer, diabetes, heart disease, but we need to bring that same level of education to mental health, and you will save money, you will save time. Imagine 7 years. And by the way, we had a brave young lady on, a great series, borderline personality disorder.
Sammy Grimm.
Fantastic young woman, brave young woman, and she went through a very similar type of experience. And it not only affects your life, how about the loved ones around you?
Oh man, guys, Sammy Grimm was misdiagnosed with bipolar disorder twice. So she is in her 20s. She goes to multiple healthcare professionals. The first 2 give her diagnosis of bipolar disorder, and she was treated for that for years. It wasn't until later she became educated and she became an advocate for herself that she got the correct diagnosis of borderline personality disorder, and then that was able to feed into the right treatment and get her the help and the peace that she was so seeking. It's a great series. I think our social media managers right now can drop a link into that series into the chat, so keep an eye out for that and bookmark that for later. If you've not ever seen a MedCircle series, you can watch one of our most popular series for free right now if you go to MedCircle.com and look for the Types of Provider series with Dr. Dominic Sportelli in honor of World Mental Health Day. That's being offered to you for $0. Or you can just use the links below this video to go right to that page and get that series. It's really phenomenal. We have a question from Sogan Lee asking, will the company tell other people and other companies about our mental illness when we change our jobs? I can't imagine they would, but they could, I suppose. Mr. Colbeth, any thoughts on that?
Well, that would be egregious.
Yes,
I mean that would be more than egregious, and I think look, you have to gauge. There's no doubt you have to gauge. You have to look for signals that a company would be open-minded to you, sharing. But I think a lot of companies and a lot of organizations are much more open-minded to it. But you've got to be careful with it, because sometimes people will still hold a stigma, and it really depends on each individual leader.
Yeah.
But if the executive team and the HR team starts to set the environment correctly, and then you'll see an outpouring of people coming forward. And what happened, at Canaxis was everybody started helping each other.
So at your
It became
previous
so
company-
organic. It wasn't management even having to keep going around promoting a product or service. It was informally people were saying, and we had, and I may have the numbers wrong because I haven't been active with the company for a while, but they just took this Autism at Work program and just blew it up, and it's fabulous. And let me tell you what
blew it up in a good way.
Yeah, they blew it up, and it's fantastic. And you know what it does? It motivates the other 450 employees that see you doing it.
Yeah.
And it makes a statement. You can't make a better statement than doing that.
Yeah, absolutely. But not everybody has that that type of environment, and if it doesn't come from the top down, it's a lot harder to accomplish. Teresa Barrett says, human resources staff need to be educated in mental illness. I agree with you, Teresa. She said that I got a doctor's note because I was in crisis mode and the HR rep re-traumatized me on the spot. I was escorted out of the building by HR. No empathy. That if you brought in a doctor's note for a broken leg, they probably wouldn't have had any stigma with that. There is still a stigma there, but I really want people to hear this because I was just on a call with one of our psychiatrists, Dr. Dominic Sportelli, during our Ask the Doctor session. And we were talking about how never before in our life, World Mental Health Day started in 1992. This is the first time I've ever heard about it.
Yeah.
And it's not because I work for MedCircle. It's because mental health is it's the tipping point for incredible change. It is more talked about than ever. People have more awareness than ever, and we've reached the maximum amount of awareness, and now that is going to start snowballing into action. And I think it starts with people who understand that education is that first step. We educate ourselves about our finances. We get educated about our relationships, how to take care of our dog, how to do everything. Where is the education with mental health? Well, you guys are doing it right now just by interacting with this video, whether you're on YouTube or Facebook. Make sure you go ahead and like and subscribe to these channels, and then go to medcircle.com for that free session. If you guys have questions for our founder and CEO, please ask them. I'm sure he would be happy to answer them. Mr. Colbeth, in your time as a leader and your time as a mental health advocate, what has been, or with those two experiences combined, how has that created a mission for you to create MedCircle? Because I'm going to rephrase that a little bit, because people think, oh, this guy just started MedCircle because he found a need that needed to be filled. But it's way more than that. This is something that runs deep within you, your family. This isn't just an idea you had randomly one day 3 weeks ago. This has been years in the making. Can you talk to a little bit about that?
Well, even as a very young child, you know, I've lost family members to mental health, whether it's untreated, undiagnosed. So I've seen the tragedy of that. My life started spinning out of control in my 20s, and I already mentioned how long it took to get on the right track. I even had a period in my life where, you know, I felt that I'd be better off, and other people would be better off if I wasn't around. And I said, if I ever get in a position to be able to make a difference in mental health, that's where we're going. And when the first venture was named Spyglass, when that went public and eventually it was actually purchased by a European company, it allowed my wife and I to build a clinic for inner city kids. Just picture this: you're in an inner city in Chicago, bullets are flying through your apartment. Kids are afraid to go above the window line. They're coming into our clinic with PTSD. Many of them have been sexually abused. And let me just say, that's not just an inner city issue. You know, 1 in 5 people, when I go into an audience of 200, 300 people, 20% of them may have been sexually abused.
20%.
The mental health impact of that It's going to come out. I mean, this is something that's going to boil over because it's so pervasive. You look at our country with 300 and some odd 50 million people. Take 20% of that number. You have 70 people out there that are suffering. Okay, and that's a topic nobody wants to talk about, right? But it affects mental health. So when I walk into a room with anyone, 10 people, 500 people, I know there's people in that room that are quietly suffering.
That's right.
And if you can immediately show some interest in them and their mental health, it helps you become a better leader.
Yeah.
So when we had the success of the first venture, we built the clinic. And the second venture, what we saw with the clinic is, and that's a treatment clinic. It's an outpatient treatment clinic. And the staff there kept saying, Mr. Colbeth, the way the insurance industry is and the billings and all that, we don't have the hours so to educate the mothers of the children and the fathers and the aunts and the uncles and the grandmothers. And that was kind of the genesis of MedCircle was these kids, along with hundreds of millions around the world, need education, and sometimes they need treatment. But the other great thing about being well educated on mental health, and if you're one of the lucky ones that doesn't ever have a severe episode or a severe condition, if you're one of the lucky ones, if you're highly knowledgeable, you can help others.
Oh, yeah.
And for those that, like myself, as one of my doctors said, I really can't tell you that much about bipolar because I've never had it. And somebody said, Doug, would you go to a psychiatrist that was bipolar? I said, you bet I would.
Yeah.
Because not only would he have studied it, he would have experienced it.
That's right.
So it's just so much we can do. I think I saw a question on the board earlier, and you had mentioned 15 or 20% of people at any given time, any point in time, are facing a significant mental health issue. It's almost 70% that are experiencing at least one symptom. This is a CDC statistic. One symptom, and quite often it's anxiety. Anxiety at work is so pervasive.
Yeah.
Okay? So as an employer, I looked for this. Why would you want 70% of your workforce? Because they won't be able to be as productive as they want to be.
Right.
As they want to be.
Exactly.
But anxiety is a huge challenge in our society. We could spend a whole nother session someday talking about that. And it's worth talking about because there's so many different causes of anxiety. And a lot of, we've got some series online at MedCircle. And we're going to be diving really deep into anxiety because it is one of the most pervasive problems in our society.
Absolutely. It has just overtaken depression as the #1 diagnosed mental health condition. I want to thank all of our viewers who have joined us from whatever platform you came on to watch this live stream. I really appreciate you taking the time to take your mental health seriously. Mr. Colbeth, thank you for everything that you're doing in the mental health world, for taking your time to speak to our members. If you guys enjoyed this, let us know. Maybe we'll do more of them. If you didn't enjoy us, tell me why. I already gave you my email address. I'd love the feedback so we can make it better for you. It's Kyle@medcircle.com. Callie, you did great. I know you're hungry, girl. It's time for dinner for her. So thank you guys for joining us on World Mental Health Day. We'll see you soon. I'm Kyle Kittleson. Remember, whatever you're going through, you got this.